Welcome to the Nursing Post podcast, all nursing all the time with Ashley, myself, and Rosa. We are here today to discuss the topic of different ataxias. And remember, our goal is always to inform and to spark some conversation.
Absolutely. So, ataxia is known as uncoordinated loss of balance and muscle movements. It's not necessarily a disease, but more like a symptom of a disease. And a lot of times, ataxia is a common side effect to certain medications. So we're all about the numbers here. So statistics show that about 150,000 people in the US deal with some form of ataxia. There is a lifetime prevalence rate of 50 out of 100,000. Ataxia is either acquired or genetic, meaning you got it because of an illness, a side effect of a medication, or it runs in your family history.
Mhm.
Friedrich's disease or Friedrich's ataxia is the most common type of the hereditary ataxia that's out there. And it's thought to affect at least one in every 50,000 people.
Right. And there are four different types of ataxias. And when you start getting into any kind of neurological symptoms or diseases or disorders, I feel like there's 17 plus different types. It gets so broken down and into, very minute, which is understandable when you're trying to treat any kind of neurological disorder. But we have the top four. I think if you actually look up all the different types of ataxias, there's technically more than four, but these are kind of grouped together in four sections. One being hereditary. That's exactly what it means. It's coming from your family. It is a autosomal dominant trait. It is X-linked, and it is also known as a mitochondrial ataxia. So these are degenerative changes that are occurring in your spinal cord and in your brain, and it is one of its forms may be present at any one time from infancy all the way up through adulthood. So it's definitely something I think that is caught pretty early on
Mhm.
in childhood.
I think so.
There is also something called the Sinocerebellar ataxia. This is also known as SCA. And this is also known as an autosomal dominant disorder. And its primary is its known primary mitochondrial mutations. So again, we're looking at something that cannot be fixed. This is not coming from a side effect of a medication. It is also X-linked, an X-linked mutation, and it's also to be considered depending on the clinical manifestation and family history. So that's how you diagnose that versus the hereditary ataxia.
Mhm.
You have sporadic and idiopathic. Sporadic just means it comes when it wants to. Idiopathic means we don't know why. Those are a little bit self-explanatory. The sporadic ataxias, they may result from a new abnormality in a gene or as a result of an underlying disease like a thyroid disorder or um, problems if you are hypoglycemic a lot, that's low blood sugar, if you had a stroke, vitamin deficiencies. So those are coming from something else. There's a reason for it. It's not necessarily a
Mhm.
gene mutation. There's another underlying cause for the
Yeah,
attack.
there's a cause, and then the ataxia is the effect. So
Right.
something is leading it and pushing it to
Mhm.
come to the surface.
Right. And then we finish up with the Friedreich's ataxia, and this is the most common. As Rosa had said, it is the most common genetic. It is an autosomal recessive ataxia. Onset is typically in childhood or young adulthood, and it is progressive, usually leading to loss of ambulation after about 10 to 15 years. It affects the nerve fibers in the spinal cord and your peripheral nerves, like your legs, and those are just kind of becoming thinner and thinner. They're just kind of degenerative disease that just slowly takes away um, your ability, your movement.
Yeah. There are signs and symptoms, as with everything. You might have one, you might have a combination of. So just because we list doesn't mean you have to have like all of these things
No,
in order to be diagnosed with any form of ataxia. But there's poor coordination. Your walking is unsteady and your feet are set like wide apart
hmm
so that your gait and your stance is just it's not within the normal range or normal limits. You have poor balance, difficulty with delicate motor tasks. So that would be being able to like pick up individual things with your fingers, fine motor skills like writing. It would affect those types of motor skills. It also affects eating, being able to button up your shirt. So you can kind of see where it's starting to affect your activities of daily living. You have a change in speech pattern, you have involuntary back and forth eye movements, and you might even have difficulty swallowing.
right. And so when you're first noticing these things, the best thing to do is to make an appointment with your primary care doctor. If you have a primary care doctor that sees this, honestly, I think most primary care doctors, if they have a reason to know that you have ataxia, whether it's from medication or another disease process, they may keep you within their office and try to manage it there. But these genetic ataxias, degenerative disease kind of ataxias, they are going to be handled by a neurologist, as they should be.
Absolutely.
And the primary care doctor will be responsible for that referral. Some people refer themselves to the neurology group if
Mhm.
one, their insurance allows it, and two, the actual physicians allow that. Some physicians don't allow patients to refer themselves. Otherwise, they would just be inundated with referrals for things that aren't
Absolutely.
necessarily what they take care of. So you just wanna make sure that if you are going, a lot of stuff will get sent from the primary care doctor, but you wanna make sure that you're sending stuff that you have everything that you need, especially if you're going to a neurologist that's not necessarily close to home. I know that we live in a small town, so if there's like a significant problem, you probably are gonna go to a larger medical center in our surrounding larger cities.
Absolutely.
But you wanna just have like your current problem list is what would I call it, or your health problems listed out, your medications, of course, any any kind of testing that you've had done, any kind of what I call imaging, MRI, CT scans, especially of like your brain, or if you're having problems with your
Mhm.
legs, if you've had any kind of imaging or scans done to those, not the report, the disc, get a disc from whoever did the study. Take that with you. I always say that reports are great, once the doctors had a chance to look at the images and agree with the report. They all wanna
Well,
see stuff themselves. If you've had genetic testing done, the information from the genetic counselors would be great. Any other information that you have, within your family history that would relate to this, neurological condition would be wonderful. And then if kind of a well-rounded, concise spiel of symptoms started here, we're progressing here. So that way they know how long it's been going on and how far it's progressed and how quickly. And then, of course, any concerns or questions that you have, write them out, take them with you. It's just easier to remember when you get in there and they start giving you all this information, you tend to forget questions that you have or may have had just because you're overwhelmed with all the new information that they're giving you.
Mhm. That's true. So some of the diagnostic testing can include, like Ashley had mentioned, blood work, imaging, a
Mhm.
lumbar puncture, which is also known as a spinal tap, and genetic testing. And all of that's important. One, to rule out whether this is hereditary or if this is just happens to be like a side effect
Mhm.
that's, secondary to an illness or to medication.
Right.
So treating the underlying cause of it is what is needed in order to kind of alleviate any signs and symptoms that you have. If it's hereditary, it's never going to go away. And I think we understand that. But if it's something that's caused by another disease process or medication, the first thing you're going to want to do is to make sure you're treating that and not just the symptoms of the ataxia. Because when
Right.
you treat only the symptoms, that's like a band-aid.
Mhm.
That band-aid will eventually fall off, and then you're going to have to start all over again. So you definitely want to make sure you get to the root of the problem,
Right.
period.
Right.
You may be given adaptive devices because your gait is not steady. You may have loss of muscle in your legs or in your arms. So you might have like a grabber, you might have a cane, you might have a rollator, a walker, even sometimes a wheelchair, just depending on the severity of your signs and symptoms and how, if this is hereditary, the progression of the disease is. So, adaptive equipment is definitely going to be needed. Therapy, like physical therapy, occupational therapy helps with your activities of daily living. Physical therapy is to like strengthen up those muscles and make sure that you're able to walk properly. And of course, speech therapy if the ataxia is affecting your ability to swallow.
Mhm.
So they do a lot of speech therapy for people that are having difficulties swallowing. And of course, medications help with the symptoms. I'm not saying don't treat the symptoms. I'm just saying don't let that be the primary treatment of
Right.
your symptoms. Band-aids fall off.
Mhm. Absolutely, they do. And when we get into neurological kind of disorders, I don't feel like there's a ton of headway. And there may be somebody that's in the neurology field that disagrees with this, but it just seems like there's such slow progress on treatments and different options for people who have
Mhm.
neurological disorders. There might be new medicines that come out, things like that, but I'm talking about like real solid moving forward. We're looking at, finding cures and not just trying to treat things within the neurological community. And so I was kind of excited when I came across an article from the NIH. It was actually published in August of 2022, which is this year for us. It was the NIH developed the first 3D structure of something called the twinkle protein, which I did research. It's literally twinkle protein, which I appreciate the easy to say name, but
Yeah,
you
no,
know,
I'm okay with it.
then my like inner nurse is like, it can't be that easy. Like it's not the, P462 dash, W432 protein. That's what I'm used to, something random like that. But it is a twinkle protein. And what that does is it allows scientists to see how and where the disease mutation on that twinkle protein, where it can lead to mitochondrial diseases. So these diseases that are starting within the mitochondria, like the spinocerebellar ataxia, is one of those diseases that actually knowing, okay, hey, this is the protein and this is what's messed up about it is a huge step forward in science.
Mhm.
Because there's a lot of times that we're like, yeah, we know what's wrong with you, but we really kind of don't know why. We don't know what's going on or what happened to make this problem.
Mhm.
So seeing where the mutation is at is really important because they can literally kind of work backwards to try to, you know, not necessarily cure, but at least start understanding why things are happening and maybe get it to stop if they see it or figure out how to better treat symptoms at least until they can come up with better options within
It's a
these
starting
neurological
point.
disorders.
It's
Yeah.
like a starting point. It's kind of like doing a maze, but
Mhm.
going backwards. It's kind of like the same thing.
Yeah,
So
exactly.
it gives them somewhere to start from.
It really, really is. So I just thought it was interesting that it was kind of very, very new that this has come out. And you don't really see it. And the NIH has made this, and I don't get anything from the NIH, but they have made it open to everybody. So it's not like they're holding this information for themselves to be able to develop
Hmm.
something. It's pretty much out there for everybody to say, here it is, see what you can do with it to make something of it. And Rosa will probably be the first to tell you that somebody is gonna get rich off of it because
That's the way it
the
works. Dollars and
that's the
cents.
United States for you in medicine.
Dollars and cents.
But, it's exciting to see because not only will it help ataxia, but it'll help so many other neurological disorders as well. It's not just limited to ataxia.
The brain is tricky, period. I
Yeah.
mean, I'm going to say that neurologists and neurospine docs have it pretty tough because, I mean, that's just one area that really you don't get to poke and prod in when
Yeah.
somebody's alive. You know what I
No.
mean? That's why it's just so hard. And I think there's just not enough research done because nobody it's not ethical, first of all, to be like, okay, I'm gonna take this out and I want you to tell me how that does for you. That's just not ethical to do things like that and
Little
keep
frowned
somebody awake
upon.
while you do it.
Yeah.
And so the only way that you get to do this research and experiment is on somebody that's no longer living. But guess
Mhm.
what? They can't tell you anything because the dead don't talk. So,
Give me any feedback.
it's
I don't
just
want
like
them to
a
give me
very
feedback either.
complex. No, if the dead is talking back to me, we have two problems. One, why can I hear it? And two, why is it back? But that's like a totally different podcast episode. That was more like for Halloween. But that's the dilemma with, I think, neurology, and
Mhm.
when you're specializing in the brain, everything, any any type of um any type of research that provides like a positive outcome is
It's limited.
monumental.
Yeah, I agree. I do agree. Well, you can find our show notes and our references and even the link to the article with the twinkle protein on our website, thenursingpostllc.com. You can visit our shop if you have anything that you would like to get there. We have a whole bunch of different types of selections. And again, thank you for listening to the Nursing Post.